Gentleman from California is recognized for 2 minutes.
I thank the distinguished chairman for yielding. Madam Speaker, I rise in strong support of this third version of legislation to improve and extend children's health insurance program, and I hope the third time will be a charm. 80% of America's, 72% perhaps, a strong bipartisan majority in the Senate, nearly every House Democrat, and at last count, 45 House Republicans, all supported this version of S-CHIP. President Bush and many of my Republican colleagues, however, opposed the previous version of this legislation. Supposedly you opposed it because, 1, it might have enabled the states to provide health care to adults. 2, children in the middle-income families might get health care. And 3, worst of all, undocumented immigrant children might have gotten health care. Also, there was a concern by some that we'd run out of money. I haven't heard that concern where we're going to get $1.7 trillion for a war that we're fighting, but at least you're worried about bringing that money to health care. The bill before us today answers those criticisms. It should be more acceptable to a few more of my Republican colleagues, perhaps even to the President. The previous version concerns have been met, rectified, and so those who vote against today's legislation can only be voting against the government providing health care to poor children who have no other means of obtaining medical care. That's the only reason left to vote against this. No other way to account for a no vote. But I'm most proud of what this bill does not do. It doesn't compromise in covering children. It adds $35 billion in new funding to the S-CHIP program, and it provides coverage to 10 million additional children. I urge my colleagues to join with me, making the third time a charm, not a strikeout, for America's children. With an even stronger bipartisan support, we may convince President Bush to do right by America's children. Let's provide him that opportunity and guide him down the path to compassion and humane treatment for all our children.